let's talk a little bit about kind of the current climate in healthcare, which is always changing. So eventually we'll have to change this video. But just to give you a little bit of history, again, we've been here for well over 10 years in the Lehigh Valley. But a lot has changed since then. Really, if we're going to talk just kind of universally about healthcare and the patients that come in and see us, for the course of healthcare right now with the patients that we're going to see, someone has a pain or a problem. So we'll just pick the low back patient because they're pretty popular. So they got low back pain. So what do? Like the typical thing that people think about now is like, all right, well, first of all, let me see if it goes away. So maybe it'll go away, I won't have a problem with it. It hangs around too long, or I'm in such intense pain that, well, I guess I better go to the doctor. Schedule an appointment. Maybe about a week later, they get in to see likely their general practitioner. So they go in to see that person, and what's that person going to do? Right now, most likely thing they're going to do is talk to them a little bit, maybe about 90 seconds, and prescribe some medication. We are very pharmacologically, dependent in our current healthcare. So you're going to get some drugs to help make you feel better. You're going to get a chemical solution to a likely mechanical problem, and take this for 30 days, see how it goes. Come back 30 days later, I don't know, it's still not fixed. Maybe I'm not any better at all. Maybe my pain is a little bit less because I've been taking the drugs and have to refill that prescription. But problem isn't fixed. The general practitioner says, well, hey, maybe you should go get some testing done. All right, so let's get an MRI, maybe get an X-ray. If your insurance company pays for that, you got thousands of dollars in more testing. And let's see what comes back. So a couple weeks later, doctor reads the results and says, hey, you know what? Maybe you should go to a specialist. We're not really kind of resolving the back pain you have. I don't see a whole lot on the test, so maybe go to a specialist. So maybe you go to an orthopedist. So you go to the orthopedist. They might take a look at you, maybe do some orthopedic testing, hard to tell. But an orthopedist is typically a surgeon. So what do surgeons do? They do surgery. So they might say, hey, this is a problem that could be resolved by surgery. Here are your options for this. So this person has gone for weeks, if not months, through the healthcare system. They end up, with not a lot of solution to what's going on. Like, oh, you've kind of got, maybe there's a disc problem, like in your lower back, and that's what's causing pain. So they've had this pain for a long period of time. And then, the patient eventually, maybe they say, hey, maybe you should try physical therapy. So weeks down the line, eventually maybe they end up at us. But a lot of times they don't even end up with us. Most of the patients that we're seeing have been through a lot of issues in the past, and tried to find a solution to it, have not found it, and eventually they end up with us. So that's how a typical patient will kind of go through and eventually get to us. That's not everybody, that's changing a lot, but that's what you can kind of expect. It's kind of crappy. I mean, they haven't been paid attention to very much. They've been sent around to a bunch of different people, and there's no solution for what's going on. Like, they're not solving the problem they have. That's what I love about what we do. Is like we get to solve that problem and get down to the root of what's going on and actually fix the mechanical problem that they have. If we take a look a little bit more, at the healthcare in the Lehigh Valley, there are large hospital systems. There's major players in the area. The two largest employers in the Lehigh Valley are the two hospital systems, Lehigh Valley Hospital and St. Luke's. So it's a big system. It's a very big system. And, we are, kind of the little guys. We have 5 offices now, but, we started out with just one. And even at that size is really not comparison to, the large hospital systems that have like 30 clinics and are all over the place. So we're different from them. We even say we really don't kind of compete with them. We do something that's different. So we are the underdog. We're the little guy. Every doctor that's at the hospital is really strong-armed to refer patients inside their hospital system. We have to fight for every patient that we get. We work really hard and invest a lot of money for every new patient that we get coming through. But we do a good job with the patients that we get, and we continue to grow. We put out a really good product, and people know that and tell other people. But pretty much right now, healthcare in our area is dominated by large systems, and we are in there trying to find the people that don't want to be in that large system, that don't want to be shuffled around to different doctors and not given answers. People that want to resolve the problems that they have, as quickly as possible. And by solving those problems, we've been able to build what we do. So those are the kind of people that you can expect to kind of see coming to Robin's Rehabilitation.